I would like to answer some of the common questions that are asked by patients. One is, how long will the treatment take? As I have already told you, our normal protocol is day 1 we do the surgery, day 2 in the morning we do the framework try-in, day 2 in the evening we'll do a teeth try-in, and on day 3 by the afternoon or evening we are going to fix the teeth and that work is done. Suppose there is some adjustment or the framework is not satisfactory, it may proceed to the 4th or 5th day. So you can take it that between 3 to 5 days, surely the entire work will be done. The next question is, how painful is the treatment according to the Simpladent concept? People who are having missing teeth would have undergone extractions, and for that the doctor, the dentist who would have been treating them earlier, would have given them some injection and so on. So the treatment part, the only difficult part is that first injection that we give. So that also the pain can be masked by putting a numbing spray or a solution we can put there, and we can use a very thin bore needle and inject the solution inside. So basically it will be nearly painless to start with. After the surgical procedure is over, the implants themselves will not give any pain because they are rigidly fixed inside the second corticals. The soft tissue around that, the gum region, will be a little bit tender. So you can imagine when you undergone an extraction, if there was a slight pain during healing, maximum is that pain only, not severe pain. I definitely have not seen any patients with any major swelling or any other problem. So a regular painkiller with a basic antibiotic is more than sufficient to take care of the pain and infection part. What materials are the implants and the bridges made of? The implant is made of grade 5 titanium. The material of choice for the teeth can be zirconium or ceramic or composite. At the moment, we'll use only these three materials unless I find something new in the market which is really good. So which means it has to cross the test of time and the biocompatibility. So many issues are there before we can jump into any new material. I normally do not suggest something unless it is time tested. I will not experiment on my patients. Will my health insurance cover the cost of treatment? Normally the insurance part, unless the patient has met some kind of a road traffic accident or the patient is covered for any specific replacement. If you are coming in for one single implant, insurance may not cover this. So you will have to contact your insurance agent and see if your insurance cover is there for dental implants. It may be covered, but as such, I don't think in India we have any insurance cover for implant placements. When is the best time for implantation? We practice the immediate loading implantology, and these implants can be placed immediately after tooth extraction. So the best time to place these implants is as soon as you extract one tooth, simply replace it with another implant and new bone will form over this and heal over a period of time. Another question is, what is the service life of these implants that I am placing? These implants are placed in very stable cortical bone and they are expected to stay for a lifetime. Now, the entire procedure is very controlled and planned very well to last a lifetime. So the cooperation of the patient in the maintenance protocol, regular control appointments to check the forces, what is coming on to the restoration, regular control x-rays to see if it is being distributed across all the implants. These are all the very essential things to maintain it over a long period of time. Once we start not following these basic rules, if there is no recall appointments are not maintained, then you are going to have problems over a longer period of time. So I suggest you will stay with your dentist in contact and maintain those teeth properly for best results. I also wanted to tell you, apart from these implants being placed for a lifetime, the restorations need to be changed from time to time based on the amount of wear and tear that is going to happen. So that will depend on the patient himself. If it's a very small built, thin lady who doesn't have much of a biting force, that will definitely last longer. The occlusal surface will not wear off. It's like a car tire which is going to get worn off after a certain period of usage. The surface of the teeth also has a certain amount of wear. Depending on the usage, if it's a very robust young man of 40 years old, the amount of time that it has to serve inside the mouth is a very longer period of time. So we will use a material which has quite a bit of wear resistance and try to prolong that. But anyway, after a certain period of time, it requires a certain amount of material to be added on top. So either we can replace the entire restoration or only the occlusal surface. We can scan only the occlusal surface and create an onlay type on top of it and just cement it on top. So it's a very, very simple procedure. This increasing the height can be done chair side within a half an hour of work, or if we are going by the CAD/CAM method, 2 to 3 hours of work. You can just come in the morning and by evening this height can be restored back to the original height what was delivered when it was brand new. One of the question is, how many implants are necessary and why? In the immediate loading implantology, we have the strategic concept and there is also the rigid concept. In the rigid concept, it is wherever there is available bone, you go on fixing the implants. That is not a very advantageous method because the mandible has a certain amount of flexure or certain amount of bending is there. So if you place the implant in the bending zone, those implants in that position will undergo a little more amount of remodeling. So when the bone remodels in that area, it is not good. It ultimately leads to failure of that implant. We are following the strategic placement of implants where you are placing in areas which are very rigid and do not undergo flexion. Normally, in the upper jaw, we place 10 to 12 implants. In the lower jaw, we place 8 to 10 implants in strategic positions which are having very strong cortical bone. These areas do not get resorbed over any time and it affords a certain amount of force to be loaded on these implants continuously throughout life, and bone will keep on getting remodeled in that region and it becomes more and more highly mineralized over a period of time. Next question is, when am I allowed to start eating? As soon as we finish placing the implants, which is 3 hours after placing the implant, I told that I will place a rubber index inside the mouth. You can start eating. Your regular meal can be on the third day. Once the permanent restoration is fixed, you will have a very, very stable foundation where you can start eating. Initially, for the first 6 weeks, till the basic bone formation is complete, I would suggest you to be on a soft diet, well cooked food. You can eat anything that you want. It should be a well cooked food. And after this, at the end of 3 months, we'll take a control X-ray. So we've taken an X-ray before doing the surgery. We've taken an X-ray after the implant placement. So this after the implant placement to the third month, whatever the surgery was done, and the bone was missing or there was resorbed bone in that region, it will start healing, and by the third month you will see a good amount of positive bone formation. By the end of sixth month, when you take another X-ray, you will start seeing mineralized good solid bone. This is another control. So immediately after the implant placement, 6 months after the implant placement. So if we are going to take every 6 months one X-ray up to 2 years, when there is no remodeling around implant and there is a dormant situation where there is mineralization of this bone is going on increasing, then we know that the forces are getting distributed into the entire bone properly, and the patient is first of all chewing the good food. There is a good amount of physiologic force which is being given to the implant, leading to a good bone generation in that region, and maintenance is good. Basically, the entire stomatognathing system has accepted, which means the joint, the muscles, the bone, and the teeth are all working in unison to help the patient. How do I care for the implants? One is regular brushing. So, which means when you get up in the morning, you brush your teeth. In the night before sleeping, you brush your teeth. You consider the implant along with the restoration that it is made as a part of you and maintain it very clean. Food should not accumulate around the implant itself. Care will be taken once we are making the restoration to have a sanitary pontic. It's a small gap around the implant so that whatever food goes can be gargled, or we can use a water pick to flush the water from that food particles from that region and remove it and swish it out. Keep this region very clean and maintain a good oral hygiene. That is more than sufficient for a good prognosis. Can I have the follow-up done by my dentist, or do I have to come back to one of the Simpladent clinics? The corticobasal implant system by Simpladent is a specialized technique which has been placed for you, and I am a well-trained person from the International Implant Foundation based in Munich, Germany, and I have been trained to place the implants, maintain the implants, grind the occlusal surface so that it will harmoniously sit inside your mouth. So like me, there are many other doctors across the globe who are practicing this science. So if somebody is nearby you, you can go there. Of course, if you ask me and I can find somebody for you in your area is best. And if that is, you don't have such a person in your area, better you will come back to me and keep the maintenance at the precise level where it should be, because I know what should be done for you, because I have placed the implants, I have made the restorations, I'll measure it and I'll maintain it for you permanently.